Hi everyone, welcome to Alvelia Live Chat. We are live streaming across 3 social media platforms on Facebook, on Instagram and TikTok. I'm Dr. Troy Young. I'm a gynecologist at Mount Alvernia Hospital and I have a special interest in managing menopause. So let's sit back and demystify some things about menopause. Thank you all for joining me live, and in the middle of your lunch, if you're eating halfway, take a little break, half an hour. Send in all of your questions on the live chat and we'll try our best to answer these. Okay? Welcome everybody. Today we're sharing about menopause, and I know lots of people think about menopause as a frightening thing, but rest assured, menopause is actually something that all women go through. If you've had your menstruation, if you started at puberty, there will come a time where you are done with having menses. So it's not something to be afraid of, it's something that we should all look forward to. But how do we live menopause well and beyond with no health issues and to the max in enjoying life and living it abundantly? Let's share a common misconception about menopause. We will wait for people to join in and come in and fill in some questions and type your questions on the chat, and I will try my best to answer them. So let's start with something of a definition. What is perimenopause? What is menopause? What is postmenopause? Menopause is actually that point in time where your menstruation ends. It's the last menstruation. But how do you know that that's the last menstruation, right? You won't know until you've had 12 months of not having any more menstruation, and of course you need to be in the correct age group. If you haven't had menses for 6 months or 8 months or 12 months and you're only 30, please see your gynecologist and see whether it's a hormonal imbalance or there could be some other problems that causes your menses not to come. It may not be menopause, of course, but if you are 50, 55, it's pretty much sure that you are at menopause. So the years leading up to menopause is defined as perimenopause. This can start 2 to 5 years before the actual last menses. Some symptoms may arise and linger for a little while. And then by the end of your menopause, it may continue to linger for about 2 to 3 years, and then it will fade off. So postmenopause is defined as the whole period of time after menopause is confirmed, and we want to make sure that you define all these things properly so that when we speak to you or your healthcare professionals speak to you, you're in the know. So we have a question: how can I maintain a healthy weight during this stage? Now, every time that I give a public talk about menopause, this is like the biggest sort of like worry. Will I age suddenly? Will I suddenly become fat, gain a whole bunch of weight? But, aging and slight weight gain happens throughout life. It's harder to maintain your weight at 40 compared to 30. You have aged from 30 to 35 to 40. It's a continuum. As our metabolic rate slows, we will start to find it harder to lose weight, easier to gain weight. So if you're doing exactly the same diet restrictions or the diet control, if you are exercising exactly the same, the outcome is also different when you are at 20 versus 30 versus 40 versus 50. At the time of menopause, because of hormonal changes, the fat distribution does change. You will change from having fat deposits in the breast and hips area to more in the tummy area, which nobody likes. So the concept may be that you've put on weight, but the weight may actually be stable. So the whole idea, hopefully for everybody, is focus on health rather than the number, the weight. It should be healthy eating throughout life so that you're prepared for menopause and all the time after that as we age. It should also be a healthy exercise program so that you stay active, you can do all the things that you've always wanted to do. After all, aging is not just a number, it also matters functionally. If we have been able to run and we now can't run, we feel old. So it's important that functionally we keep up. There is another question here. Is it safe to go on pills to manage symptoms which can be unbearable? Now, the viewers would be happy to know actually that only 20 to 30% of women in Singapore suffer symptoms to the effect that they self-define as moderate to severe. So a majority of women go through menopause without too much problems. So you may go through menopause with either no symptoms, very mild symptoms, or just transient symptoms. But 20-30% of women will have hot flushes, mood swings, sleeplessness, aches and pains, find it difficult to manage day-to-day activities around the time of menopause or slightly beyond. And for these 20-30% of women who have severe enough symptoms, do talk to your healthcare professional about all the options you can go through to manage those symptoms. We usually start with lifestyle choices, wanting to see if we can manage these symptoms by just modifying what you do, what you eat, how you get to sleep, your sleep hygiene, so on and so forth. If that fails, are there supplements that you can take? Are there phytoestrogens that you can take that can modify the symptoms sufficiently? But if not, hormone therapy is another way to manage menopause. Now, you will also be happy to know that there are many hormone therapy options that are very suitable for most women out there, and we will judge based on the risk-benefit profile that you personally have. And these are based on your family history, your personal medical history, what medical problems you might be at risk of naturally, what are the medical problems that you are least at risk of, and see which are the medications that are most suited to you. So do not be afraid even if you suffer some symptoms. There are many things that we can do to help you alleviate those symptoms. There is a Facebook question here from Summer Rain. Hi Dr. Chua, any supplement that we should start taking for perimenopause? Well, one of the things that we worry about post-menopause are the risk of heart disease as well as osteoporosis. So it's very important that lifelong we are gearing up for midlife and old age. And these risk factors are also the risk factors that will increase once your hormones, the female hormones, the estrogen levels drop at the time of menopause. So what you want to do lifelong is to try to target your lifestyle choices, your diet, your exercise, even the supplements, to make sure that you are not at risk, or at least you mitigate those risk factors. So for example, for osteoporosis, it matters that lifelong you are not calcium deficient. I know that a lot of Asians are lactose intolerant, so we're not really big on drinking milk or taking dairy products. It's very important, therefore, that you look at calcium supplement. So even as a kid, those who do not drink milk at all, they should be on a calcium supplement. That's a daily requirement, and not wait for osteoporosis to set in and then scramble to replace. Taking calcium does not build bones back. It only slows down the process of osteoporosis. So it's very important that lifelong calcium is not deficient. Another vitamin that people forget is vitamin D. Vitamin D is plentiful if we're in sunny Singapore, but that only works if you are out in the sun. So a lot of ladies are avoiding sunlight like crazy because we all do not want to get freckles and we do not want to get pigments. So it's important that you realize, even though we have a lot of sunshine and our skin can make vitamin D, you may not have exposed the skin enough to have enough vitamin D. So many women are actually vitamin D deficient. So calcium, vitamin D, very important elements that you could consider supplementing for the purpose of preventing osteoporosis, which is a risk post-menopause. For those who just joined us, welcome to Alvernia Live Chat. I'm Dr. Chua Yang. I'm a gynecologist at Mount Alvernia Hospital. Today we are sharing and answering questions on menopause. Please leave your questions in the chat and we'll try to get through all of them. And we have another question here from Sue HN. Hi doctor, can I ask what are the early signs that I am entering perimenopause? Well, the normal age to reach menopause is 45 to 55. So if you're entering the 40th year, you've passed your 40th birthday, it is around the time that you may be reaching perimenopause. Not yet at menopause, but perimenopause. Some women do menopause particularly early, and those who reach menopause before 40, they have a condition called premature ovarian failure. And then for 40 to 50, it's called early menopause. So there are various different definitions. But if you are in that decade and you're starting to feel a little bit of that hot flush, unstable moods, menses have swayed, the cycle lengths have changed, it's become unstable. Firstly, make sure that you don't assign every symptom that you feel to be menopause. Not everything is a menopause. If you have a headache when you're 50 years old, it may not be menopause. It may be something else. So you cannot blame menopause for every single thing, okay? It's important that we realize as our hormones drop, menses is usually going to get less and less. And as we go nearer to menopause, an easy way to understand is the concept should be that menses should be less and less, not more and more. So if you have 12 menses in 12 months, and now occasionally you skip a month, that may be menopause. If you have menses for usually 5-6 days in a row, now 3-4 days is done, it's cleared, okay? That may be that your hormones are reducing, it may be that things are starting to change. But if you have 2 menses a month, 3 menses a month, menses that come and doesn't stop, or in between menses, there's spotting, staining, it carries on, please don't just assume it is menopause. There could be something else that is brewing. Please see your gynecologist, do your latest gynae routine screening, get it checked, make sure it's not something else. Okay, we have another question from Anne Marisa. Is there anything we can do in our 30s and 40s to minimize the impact of menopause later on? Yes, there's plenty of things that we can do. 30s and 40s is a really good thought, but I suggest starting from young even. Healthy lifestyle should start the minute we are born. Healthy eating should be something that all mothers bring to their children so that they're not eating junk food. They have this whole concept of eating healthy. When they get to midlife, they're not just going to get diabetes, they're not going to get an obesity problem and other health issues. But you know what? When menopause is concerned, this is even more important. Let me explain why. If you are suffering menopause symptoms in a big way, you are worried that if you take hormone therapy, it may cause other risks. Well, let me explain. The biggest risk that hormone therapy have actually would be 1, deep vein thrombosis, cardiovascular changes, and then breast cancers. So these risks particularly are at risk for people who are obese. Certain races have higher risk. If you're a smoker, you have higher risk. If you're sedentary, you have higher risk. So imagine that a woman comes to menopause, suffer a lot of symptoms, go to the doctor, want hormone therapy, and the hormone therapy look at a woman who is obese, who's smoking, who have a whole bunch of risk factors already for clots in the blood vessels, cardiovascular problems, and then breast cancer risk is also increased with obesity and smoking. This person would not be a really good candidate for hormone therapy. The risk would magnify. But if you come to menopause and you suffer symptoms and you are coming as a healthy individual, you have always exercised, you've always eaten healthy, your cardiovascular disease risk is really, really quite low, your cancer risk is quite low, there's no family history, you're an ideal candidate for hormone therapy. You wouldn't have to worry if you go on hormone therapy, if that is in fact a need. You are then able to take a medication to solve all of your symptoms without too much worry that it may create a complication or a side effect. And that's really important. It opens up your options. It gives you a lot of flexibility to decide how best to manage your quality of life. And that's really important. We have one question from Agnes Cole. I often hear menopause speeds up aging. Is that true? Now, we answered that a little while ago. Maybe you've just joined us. But let me say this again, aging is a continuum. You've aged from 31 to 32. That's a continuum. If you're sun exposed and you've never looked after your skin, you've never moisturized, you've never sunblocked, you don't drink enough water, the skin's gonna age prematurely. You're gonna have wrinkles more, you're gonna have freckles and pigments more because you've not looked after that. They don't just suddenly appear at menopause. It usually is a lifelong continuum. There is a question from someone called Kirari Michishige. Is it true if our menstruations start at a young age, we will reach menopause earlier? No, it's not correlated that way, unfortunately. Doesn't quite matter whether you started menstruation early or late. It doesn't reflect when menopause will set in. There is a little bit of familial correlation. So if your mother, your older sisters, the females in the family all reach menopause unusually early, then maybe yours may come slightly earlier too. So check out the family history. Take an opportunity to ask your mom or your older sister how their menopause went. Chit chat about it, because menopause is not often spoken about. There's a whole stigma around it. I think it's so wonderful that we can talk about menopause, bring it to everybody's awareness so that within the family, the females can support each other and talk about menopause too. Now, it is important also what age group menopause happens, especially with regards to breast cancer risk. One of the things people worry about with hormone therapy is breast cancer. The thing is, breast cancer increases if the total number of years of hormonal exposure increase. So if you naturally start menstruation rather young, before the average age of 11, for example, and you're the person who reaches menopause particularly late, like 58, at 60, you're still menstruating, actually naturally you may have a slightly higher risk of breast cancer. So it's really not the medication that creates a cancer, it's just that it continues to expose your breasts to hormone exposure. So the longer you have hormone exposure to the breast, the slightly higher risk the breast cancer risk becomes. So it does make a difference at what age menopause sets in. For those of us who just joined, this is the Alvernia Live Chat. We are talking about menopause today. My name is Dr. Chua Yang and I'm from Mount Alvernia Hospital. Put in your questions at the chat boxes and then we will try very hard to answer those questions. We have a question from Mary. Hi Dr. Chua Yang, if I have fibroids in my uterus and I don't wish to remove them, will they shrink on its own after menopause? Yay for menopause! This is one situation where certain problems are solved naturally. If I see patients with fibroids and they're already in the perimenopause age group, if they are not hugely symptomatic and the fibroids are not causing health issues immediately, we do try very hard not to have the patients end up doing surgery, because there is a huge possibility that when menopause sets in, when the hormones do not continue to stimulate the fibroids have an opportunity to at least be stable in size, not to continue growing, and possibly shrink a little. So, but keep in mind though, if you're bleeding a lot, if it's causing you to have pee and poop problems, is causing obstructions, you may not have that much time to wait till menopause happens. After all, we don't know when the menopause will in fact be. So still discuss the individual situations with your gynecologist and not make unilateral decisions about the health issues. We have another question for Clara Teo. Will fish oil help in reducing belly fats due to hormonal changes? Not really. I do think that healthy eating, reducing, deep fried foods and oils and bad oil types will help a little. Taking good oils is good for blood flow. So fish oil has a blood thinning effect. It promotes blood flow. We give them to pregnant mummies because it helps with brain development for the babies. All sorts of oils are necessary for body functions. So taking healthy oils will have multiple types of benefits to you. But specifically to reduce belly fats, There is a lot of work to be done in terms of exercising, lifelong eating healthy. And let's not worry about fats so much that, I know a lot of ladies are worried about weight and always try to be thin. But let me also encourage all of you, if you are particularly thin, you're at least more at risk of osteoporosis, and that is a real health hazard. If you fall down, you don't have paddings on your bones, so the fracture risk is in fact larger as well. So most of us who are at least suitably padded have got slight advantage when it comes to osteoporosis. So do not be afraid of that, and do not wish to be very, very thin. The other thing about aging is that when you come to about 60, 70 years old, then you can look at the slightly older women around you. There is a period of time where we will all shrink and we will all sort of drop weight. And if you look at grandmothers, your great-grandmothers, remember that period of time, you may realize that that is true. By which time, it's actually very hard to put on weight no matter how hard they maybe eat or even start exercising to boost muscle growth and stuff like that. So the idea is always to prioritize health. Prioritize not getting things that your genetic makeup may set you up for, but not to focus so much on wanting a number, to be thin, to be svelte. That's not the priority here. Well, we have about 10 minutes left to our chat, so please put in your questions on the chat and let me know how I can help. We try very hard to answer all of your questions today, and if not, we will try and still answer them if you DM us. There is a question here from a member of the audience. How do I deal with hot flushes and night sweats? So, firstly, it is important to make sure that these are recent changes, that you've not been suffering these all through your life, because it may be due to something else altogether. But if it is something that comes in the time frame of perimenopause, then it's a fairly typical symptom related to perimenopause or menopause. It depends on how often it comes. It depends on your daily requirements. So if you imagine that you have twin sisters, genetic makeup is the same, and they both suffer hot flushes. One is a homemaker, semi-retired maybe. One is a CEO of a company, or maybe somebody who is a marketing executive, meeting clients, going out to meet people, talking to people, trying to sell something, a concept, a product. These people have very different needs. So they both suffer, because they're twins, they both suffer 10 hot flushes a day. One person who's sort of gardening can just go have a shower, change your clothes, get a cold drink in, feel better, rest, chill out for a while, manage that lifestyle, totally okay. But the other one who's meeting clients and suffer these exact 10 hot flushes, who's not sleeping well because of night sweats, she's going to have a lot of problems. So these things are individual. You need to assess how much it is affecting what you need to get through in your day to understand whether it is bad or it needs treatment, whether it needs a management option. So the dealing with it can be very, very different. But if you feel that it needs to be managed actively because you can't cope, please see your gynecologist or at least your family physician. Hopefully you can get a good advice on what are the options that we've spoken about, how to clean up that sleep hygiene, how to manage the hot flush, alter your diet choices a little bit, maybe consider a supplement, and if not, consider hormone therapy to see whether that's a suited choice or not. What changes? There's a question here from the audience. What changes should I make to my diet during menopause? Well, I'm hoping that if you've been listening to the last 25 minutes or so, that you would understand I'm a big proponent for eating healthy, good lifestyle choices from young. Don't just start when you reach menopause. Please start as early as you can. Teach your kids, in fact, to eat healthily and exercise regularly. The healthy eating will give you a lot of options to manage your menopause symptoms if you need medication. It will also prevent certain health disease coming at midlife and old age. So that's really important. And in terms of diet, specifically for hot flushes, I would say that things that heat you up, give you sweats naturally, even as a kid, for example, chili, spicy food, hot food, you may want to modify that and take a little bit more neutral things. Eat a little bit more ching, as I always tell my patients, you know. Eat like the Teochew Anyas do. Very clean eating, healthy, good produce, you know, very clean things. There's a comment from the audience. Mount A is a go-to hospital for delivery. Staff is amazing. Oh, thanks! Yeah, I'm sure the Mount A team here is very delighted to hear from you, and we thank you for having that good sentiment for us. I think Mount Alvernia Hospital have a whole team of staff that has been very people-centric, and we really help all our mothers cope, especially the first-time mothers. So thank you so much for that comment. There is a question here from Jen asking if flax seeds are good for women. I think all high fiber, natural, superfoods, they're actually all very healthy choices. A lot of women will ask me this, oh, when I talk about eating healthy, they will say, oh, okay, I go find salads. You know, I'm not sure that we all need to eat salads in order to be healthy. We don't need to, you know, target one specific food to try to be healthy. It is always about not overeating, eating less processed food, cutting down on high sugar foods, too much carbohydrates that we cannot burn because we're not doing that much exercises, making sure that you're not just accumulating excess. That's the general principle to go to. I'm not a big believer of just finding one food that is, you know, current flavor of the month, noted to be healthy, and then just eating it as much as possible. That may not be sustainable. So let's see. There are some questions here that are fairly personal and about specific symptoms. If those are your questions, what you can do is to try to DM the hospital, and then we can assign or address those questions and maybe point you to the right healthcare professional to look into. So perhaps I won't answer questions that are highly personal or is very peculiar. So let's just answer those questions on the DM. We can take that offline. We have 3 minutes left to our time today. I can take 1 or 2 more questions if you want to quickly type that into the chat boxes. But thank you all for joining us this lunchtime, and I hope that I think the take-home message today should be that menopause is a physiological phase that all women who have menstruation will one day come to end that suffering of menstruation. So for a lot of women who have been fussing about sanitary products, about blood, about seeing blood, about managing that, about losing so much blood that they've become anemic, you know, about the fibroids that have grown and has caused some symptoms, those will come to an end. And I think many of these women will be very, very happy about in this situation when menopause sets in. Our last question to wrap up our session here is, what kind of specialist should I consult for menopause management? I think if you have a good family physician whom you have always spoken in depth about your family needs and you're very comfortable talking about very personal things too, then that's a good place to start. If that family physician does not manage menopause specifically, hopefully he or she would be able to point you to the correct gynecologist who will manage this. But otherwise, your gynae would be the next in line to give a shout out to about what you are suffering, how you can prepare for it. Even when you're talking about going through your pregnancy, you may want to ask questions because you might be seeing your mother go through menopause. See if your gynecologist can answer some simple questions about it and go from there. So, thank you. Oh, nice. We have a last comment from an audience. Thanks, Dr. Chua. You have given me more reasons to look forward to menopause. Part of the journey as a woman. We have learned a lot from the session. We'll start taking calcium and vitamin D. Very, very nice. Thank you for that comment. I love it. We want to say thanks to all the audience who have participated and sent in all the lovely questions and the very nice comments. Thanks for joining us today. I had a lot of fun answering all these questions. And in case you missed anything, please look at it when it is up on the social media platforms, and also continue to DM the hospital if you have further questions and want to know who to look for. Okay, thank you so much.